Hello, I'm Maxim Barron. I'm your physician assistant student that's going to be doing your exam today. Today we're going to be doing your general health survey as well as your HEENT exam. If you could, please take your shirt, shoes, and socks off while I wash my hands. First thing I'm going to do is inspect the patient's general health as well as presenting appearance. I'm going to inspect to see if the stated age correlates to the apparent age. I'm going to inspect to see the general grooming habits, hygiene, as well as if there's any odors coming from the body or from the breath. I'm going to inspect the patient's body habitus as well as any obvious physical deformities. I'm going to inspect the patient's posture as well as motor activities. I'm then going to inspect the patient's face for any signs of pain and or distress. And then at this point, I would conduct a mental status exam. I am now going to assess the patient's vitals, starting with the height and weight. Then using a thermometer and the guard for the thermometer. If you could, please leave this underneath your tongue for either 1 minute or until it beeps. While this is happening, I'm going to assess the patient's pulse by using the pads of my index and middle finger, counting how many times it beats within 15 seconds, making sure to appreciate the rate, rhythm, and amplitude of the beat. I'm going to multiply it by 4 after 15 seconds. Then I'm going to observe the patient's respiration rates, counting how many times she breathes in 15 seconds, multiply it by 4, making sure to appreciate the rate, rhythm, as well as depth of respiration. And then I'm going to grab the blood pressure while we start doing it. We're still waiting for the thermometer. Okay, can I see your arm, please? I'm going to make sure that the bladder of the cup is appropriately fitting, and make sure the width is at least 40% of the circumference of her arm, as well as the length is at least 80% of the circumference of her arm. I'm going to feel for her brachial pulse, brachial artery, and then I'm going to place this an inch above the antecubital fossa. I'm going to determine the palpable systolic pressure by feeling her radial pulse and inflating this until I'm not able to feel it anymore. When that stops, it'll tell me what her palpable systolic pressure is. Okay, then I'm going to add 30 mmHg to that, inflate it to there, and the moment I hear, then slowly release it, and the moment I hear the first quick cough sound will be the systolic blood pressure. I'm going to wait for that thermometer actually. Okay, perfect. All right. I'm going to listen for the first quarter cough sound after I inflate 30 mmHg above the palpable. Then I'm going to slowly release it for 2 to 3 mmHg until I can't hear any more cough sounds. And that will be for diastolic. Now I'm going to repeat this on the other side. So I can see the arm. Perfect. Inch above the antecubital fossa. Wrap it around. Gonna inflate it 30 mmHg above the palpable systolic. First part cough sound, cessation of cough sound. I'm going to record both of these numbers, and then I would repeat this in both a supine and standing position if necessary. Now we're going to begin the skin exam, so if I could have you stand up, please. I'm examining the patient's skin pigmentation, looking for any discoloration, also looking for any masses, rashes, or lesions. If I could use arms to the side, down, and then if you would pull up the pants a little bit, perfect, and turn around. I'm also examining the same thing on the back, then if you could lift your feet up, good, other foot, perfect, and lift up your pants, Good. All right, then you can sit back down. Or actually, stand right here, look towards me. I'm going to palpate the patient's skin for temperature, texture, and moisture. Temperature using the back of my hand, up and down, texture, moisture, and then I'm going to palpate for mobility, interior. We'll do the same for each of her extremities. All right, then you can sit back down. I'm now going to examine your fingernails. You show me your fingernails and toenails. I'm going to be inspecting for cyanosis, brittleness, lines, lesions, or clubbing. Those all look good. We're now going to move forward with the head exam. I'm going to start by inspecting the head's position, size, shape, contour, any abnormalities in symmetry. I'm also going to examine the patient's face for any hair growth, edema, masses, or symmetry. And then I'm going to inspect the patient's scalp. I'm going to be looking here for hair growth pattern, hair texture, any lice, lesions, nits, or dandruff. And now I'm going to palpate the patient's skull, feeling for any contour, tenderness, deformations, or masses. I am now going to palpate the patient's scalp, looking for any tenderness and mobility. I'm then going to palpate the patient's temporal arteries, feeling for pulsations and tenderness. Then the TMJ joint, if I could have you open your mouth, push it out forward and back and side to side, feeling for any tenderness, crepitus, and deformation. I'm then going to feel the patient's parotid glands, feeling for any edema or tenderness. I am then going to palpate the patient's forehead, supranasal or supraorbital ridge, zygoma, and mandible. And then we're going to move on to the eye exam. I'm going to start off by inspecting the patient's eyebrows, eyelids, and eyelashes, looking for any asymmetry, arrhythmia, or lesions. I am then going to look at the eyelids for both position and closure. I'm then going to inspect the patient's bulbar and palpebral conjunctiva for injection and lesions, and then I'm going to inspect your sclera for, if you could look up, discoloration, or look down, any injection or presence of blood. And then we're going to start with the visual acuity exam. So if you can, please hold this out as far as you can with your right hand. You're going to cover your left hand, or your left eye with your left hand, then read for me this line.
9, 5, 6, 2, 3.
Perfect. Then if you could switch hands, do the same thing. Just tell me what those are.
OXX.
Okay. Then if you could, both of your eyes together now, tell me the direction of those E's. You could take your hand out.
To the right, left, and up.
All right. Then I'm going to examine the size of her pupils. I'd say that's a 4. And that appears to be a 4 as well. Then I'm going to examine her peripheral vision by gross confrontation. If you can, raise your hand for me the moment that you see my fingers wiggling. These are going to come from 3 different positions. So the moment you see the wiggling, good, good, good. And then we're going to test your extraocular muscles. If you can, please follow the tip of the pen or pen light with your eyes. Don't move your head at all. It's going to go outside. And testing for lid light, please follow the pen with your eyes. And then we're going to test for convergence and accommodation. If you could look way out in the distance, I'm going to raise the tip of the pen. The moment you see within your vision, please look at the tip of the pen. look, and then watch the tip of the pen. I'm just going to come closer. This will be convergence. All right, good. Then I am going to inspect her cornea as well as the depth of the anterior chamber of her eye using tangential lighting and noting any crescent shadowing on the medial aspect of her nose. I'm now going to test the pupillary light reaction by both direct and consensual lighting. So if you could just look straight ahead, I'm going to shine a light in one of your eyes. Good. 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 Perfect. Okie doke. Now we are going to begin with our fundoscopic exam. So I'm going to dim the lights in here. Make sure this works. Perfect. Doctor's good. All right. I'm going to stand 4 feet away from her. In midline, look for corneal light reflex in symmetry in both the eyes, which looks good. I'm going to approach 15 inches away, 15 degrees from midline. I'm going to examine her eye with this side. I am looking for the optic disc and margins. I'm looking at the cup to disc ratio, the retinal arteries and veins, as well as the condition of the retina. And then if you could look into the light for me, I'm now examining the fovea and macula. Now I'm going to do the same to the side. Look into light. Good. Yeah. Okie doke. And then we are going to proceed with the ear exam. I'm gonna get the otoscope, make sure this works, put on an accurate fitting speculum. So first thing I'm gonna do is inspect the auricle, make sure that there isn't any deformations, discharge, or masses. I'm going to palpate it, make sure there isn't any tenderness or masses or deformations. I'm going to palpate the tragus, and then I'm going to do the whisper test. So I'm going to cover this side of your ear. I'm going to whisper a word into this side. If you could just repeat back to me.
Apple. Cupcake.
All right. Palpate this side, tragus. Now I'm going to inspect the inside of her ear. Make sure this turns on. I'm going to use my pinky as a fulcrum, look inside. All right, I am examining or inspecting the condition of the external ear canal, making sure to take notes of any cerumen buildup. I'm visualizing the tympanic membrane. It is a pearly gray color. I'm visualizing the landmarks of the tympanic membrane as well. I see the umbo, the malleus, as well as the cone of light. I'm going to do the same for the other ear. Making sure that I'm pulling back on the ear, exposing and using my other hand as a fulcrum. Okay, perfect. And then we're going to begin with the nasal exam. So I'm swapping out these. Okie doke. So first, I'm inspecting your nose, making sure there isn't any deformations. If you could, please close one of your nostrils, then breathe through the other one, and then do the same with your other hand. Perfect. I'm then going to palpate her nose for any tenderness. All right, now I'm going to examine the inside of her nose. I'm going to be, if you tilt your head back, I'm going to push up a little bit here. I'm examining the nasal mucosa, looking for irritation. I'm also examining the nasal septum, looking for perforations or any deviations, and I'll show you the name of it. the other thing for polyps. All right, so then we're going to continue with that. Put that to the side. I'm also just going to go ahead and recheck her eyes for the lacrimal apparatus. I'm inspecting lacrimal apparatus for any edema or lesions. I'm also going to palpate above the area above the lacrimal apparatus, attempting to get any discharge out of the nasolacrimal duct, express any discharge out of the nasolacrimal duct, also looking for any tenderness. All right, so now we're going to proceed with the oral exam. I'm going to use this. Okie doke. If you could open your mouth for me and look up. We got a vibe. All right, I'm examining the nasolabial fold. I'm examining the lips, the buccal mucosa. Stick your tongue up, through for your mouth, the floor of the mouth, as well as the gingiva, and then the teeth. I'm making sure to note any inflammation, any lesions, and the condition of dentition. Then, if you could, stick your tongue out, and then say ah. I'm examining the posterior pharynx, making sure to note the condition of the tonsils. I made sure to appreciate the phonation as well as the symmetrical raising of the palate and the uvula during her saying ah. Then if you could stick your tongue out for me. I'm also making sure to watch. There was a midline protrusion of the tongue as well as the color and texture. And now I'm going to put on clean gloves. So look at the nasal terminates for polyps. I'm going to use a clean thing of gauze. And then if you can, please stick your tongue out for me. I'm going to be palpating the sides of your tongue, making sure to look for any induration or masses. Perfect. Okie doke. And for the visual acuity, I would repeat it with and without glasses. And now we're going to examine the neck. So first thing, I'm going to examine the neck for for enlarged thyroid, jugular venous distension. I'm going to examine for any masses as well as any asymmetry. Then I'm going to examine to make sure her trachea is in the midline. And then if you could raise your head for me, all the way back. And I'm going to examine her thyroid as well as the isthmus to make sure that they're in the midline position. Can you please follow for me? Perfect. Now I'm going to come behind you. I'm going to displace your trachea and try to palpate your thyroid. So it's going to push to one side. I'm going to push it to one side with my right hand, then I'm going to palpate it with my left hand. So if you could, please swallow. And then I'm going to do the other side, please swallow. And then I'm going to touch the midline, make sure I can feel the isthmus, please swallow. Okay. And then we're going to continue with the lymph node examination. I'm first going to palpate all these for tenderness as well as size, the preocular lymph nodes, postocular, occipital, anterior or superficial cervical, posterior cervical, and then if you tilt your head to the right side, my right, I'm feeling her deep cervical, and then the other side, perfect, deep cervical. I also forgot to do the tonsillar, submandibular, submental, and then if you can, please take a deep breath, and I'm feeling her suprascapular. Okay.